This podcast represents the opinions of our hosts and their guests only. The content here should not be taken as medical advice and is for informational purposes only. And because each person is so unique, please consult your healthcare professional for any medical questions. Welcome to Once Shattered, Picking Up the Pieces, a podcast devoted to changing the way eating disorders and mental illness are viewed in our society. With your hosts, Jack and Linda Mazur and Ellen Bennett. Today's guest is Brooke Huminski. Brooke Huminski, MSW, LICSW, is a psychotherapist with a private practice in Providence, Rhode Island. She specializes in treating individuals with eating disorders, perfectionism, ADHD, and school-related stressors. Brooke has her own eating disorder recovery and is passionate about reducing stigma in the field, especially among professionals. Related to this, she co-leads a supervision group for eating disorder professionals with their own recovery histories. Over her 15 years working in healthcare, her mission remains to be present with others in times of suffering, offer hope, and work towards systemic change. She works on the latter through offering education to peers in the Providence and Boston eating disorder communities. She is also a guest lecturer on eating disorders at the Brown University Adult Psychiatry Residency Program. In addition to psychotherapy, Brooke works part-time as a psychiatric emergency room clinician at Butler Hospital, evaluating adolescents and adults in times of mental health and substance use crisis. In her life outside of work, she has a lifelong love of singing and attending and previously participating in musical theater performances. She has a golden doodle, Maisie, who is a therapy dog in slow training, and a cat, Francisco, who both bring comfort, humor, and joy to her life. She sings in the choir at an inclusive Episcopal church in Portsmouth, Rhode Island, and afterwards enjoys exploring nearby Newport. She is grateful for the incredible community of friends, colleagues, and professionals who have supported her throughout her personal and professional journeys. Her website is brookehuminski.com.
Welcome, everyone, to Once Shattered, Picking Up the Pieces, episode 122. Today's podcast is brought to you by the Emilee Connection and KMB for Answers. My quote for this episode is, "The human heart has a way of making itself large again, even after it's been broken into a million pieces." And that is by Robert James Waller. I'd like to welcome my husband, roommate, and best friend, Jack Mazur, and our dear friend and fellow advocate for eating disorders and mental health, Ellen Bennett. Welcome, guys.
Hello, hello.
Great to be back, and this episode is called Authentic Change, Psychotherapy, and Much More with Brooke Huminski.
Well, Jack and I met Brooke at an eating disorder gathering in Rhode Island, and at the end of the evening, we had a little time to sit and talk together, and she is absolutely wonderful, and I think you will just love her like I do. And I'd like to introduce her to you right now. Welcome, Brooke.
Thank you so much for having me. So glad to be here.
We're honored to have you here. Do you want to share a little bit about yourself and some of your ED recovery journey with our guests?
Sure. I'm a psychotherapist in Providence, Rhode Island. I practice both in Rhode Island and Massachusetts, originally from Long Island, New York, but came up here for school and never left. My eating disorder story is, like most people's, individualized. I developed an eating disorder in middle school, high school. It lasted for about 10 years, maybe more than that. Mixture of different symptoms. At the time, it was called eating disorder, not otherwise specified, now known as OSFED. But basically means it was a combination of anorexia and bulimia. As typical with eating disorders, had the rigidity, the compulsivity, the mental anguish. In reflecting back on the eating disorder journey, just a lot of fog. I felt like that whole period of my life was I was just in a bit of a fog the whole time. There's a lot of shame, a lot of secrecy, a lot of this belief that is also very common, that I just wasn't sick enough to really need or deserve treatment. And then I just had this genetic loading, right? I come from a family where very strong genetics around anxiety, depression. Certainly grew up in an environment where there were certain challenges and difficulties. The culture in where I grew up was very diet focused and focused on certain body types. That still exists in other places and to this day. But I struggled. I went to treatment. I tried different treatment options, different levels of care. At times, was really not sure if I was going to get better or get through it. And there were people around me who really supported that I would, and then some, especially some professionals who weren't as hopeful. I was very lucky to be connected with a dietitian pretty early on when I was in college who transformed my life. At one point, she said to me in response to my saying, well, some of these eating disorder pieces are helping me cope with the anxiety or the depression or the pieces of my life that are really hard. And she said, well, what if God wants more from you than this? And that really stuck with me. And then the question became for me, what do I want more than the eating disorder? What do I want more in my life? And I had a real pivotal point where I did access treatment for a longer period of time. And then from there, moved into grad school where I studied clinical social work, where I started working, where I started feeling connected to others. And along that time, met a community of people who helped me learn about asking for help, about building better relationships. Again, my spirituality played a big role here. And that's the best summary I can give. Of course, other pieces along the way, but very grateful to be in this place.
Well, thanks for sharing that with us. It always helps to know where people's journey began and look at how far you've come.
So just the question, were the doctors and that dietitian, were they educated and trained in eating disorders, specialized in it, or no?
Yeah, my dietitian was specifically trained in eating disorders. A few of the doctors I saw along the way were not, and I lived in Rhode Island through most of my recovery, and Rhode Island now has a higher level of care, but at the time did not. And the area has really been growing in terms of eating disorder access, but it was pretty isolated and quite limited in treatment options at that time.
Yeah. Okay. Well, I know we met you in Rhode Island, and the way the tables were for that dinner, I was kind of like at a different table, so I didn't talk to you as much as Linda did. But after after dinner was over, got back to Betsy's house, she said how wonderful you were and how we had to have you on this podcast. So I'm glad I get to talk to you some more when I didn't get a chance back then. And I just love how you specialize in treating people's eating disorder and the perfectionism that comes with these people, and the ADHD and all the school-related stressors. Do you treat children in grammar school and beyond, and is there a specific population that you're most drawn to?
Yeah, well, I first want to add, I really adored meeting you both, and again, appreciate the opportunity to be here and the work you're doing. So I work, the youngest I've worked with is 13, and when I see adolescents, I only treat them for eating disorders because that's where my training is. I really enjoyed those different specialties you just mentioned, Jack. And I found this subspecialty of people who just seem to come to my practice who typically women, typically have eating disorders or some type of disordered eating, and then perfectionism. And then sometimes we uncover along the way this undiagnosed ADHD that really kind of puts a puzzle piece together that for people. So I really enjoy that group. Though I enjoy everyone that I work with and all the different folks who come in. I'm privileged to sit beside, as well as I really enjoy working with adolescents and families, or young adults and families. I think the tides have really shifted from parents. I don't know, the way we used to see parents and the way we now see parents as such allies and supports. And I really enjoy helping people through those crisis periods and getting to a long-lasting recovery.
Nothing like somebody who's been there and is a professional, right?
So you said the youngest is 13. And you have some young adults. How old?
Yeah, I see. And my office is right near Brown University in RISD. So I see a number of students in college and then graduate students. I'd say the oldest, I worked with some older adults because some of my training is back in medical social work and later aged populations, but with eating disorders, more like into 40s. But I tend to more work with people who are adolescents, young adults, and then adults.
Okay.
Well, I am delighted to meet you today. This is wonderful. I have a very special place in my heart for Rhode Island. We used to go to Charlestown Beach every summer and just have the best beach vacation. And I think it's so inspiring to talk with someone like you who has been through and come through, and now you are able to help others, and you are using that experience and embedding it in your practice. And it warms our hearts, I think, when we see you made it through. You give us hope, and they're the stories that need to be told along with. And I think on many levels, you become some of the most successful practitioners because the individuals you work with can even feel that you get it, So, on to my question. I am always thinking about as myself and as individuals that we always want to do something. And I'm curious what your advice would be about how can we end the stigma and shame associated with mental illness and eating disorders in this toxic body-shaming environment we live in. Often we wonder what small steps we can take as an individual, and then how can we help create a more supportive and accepting culture on a bigger scale? What are your thoughts?
Yeah. I have to give a nod to the amazing beaches. Right. Certainly for Gail and on that here in Rhode Island. And then again, this is an incredible opportunity just to feel heard in terms of my own kind of story and the way I can bring it to a broader audience. That's such a great question or series of questions. Certainly, I think there's been progress made around the shame and stigma. You're certainly doing it all right here, right? This very podcast is breaking down these walls of things that we maybe learned at some point we shouldn't talk about, or shameful to talk about, or shameful to even have. So when I think about those questions, I think about leaning in to the hard stuff, leaning into what's going on with people when we may feel uncomfortable ourselves with even sharing some of that pain, sharing some of that burden. Certainly with eating disorders, there's such a culture still around looking at bodies, criticizing men, women's, people of all genders, bodies, people's work being defined at an early age by their shape and appearance. And then again, just in some cultures, some places, that idea that we just can't talk about these things. There's a phrase I like, that we're only as sick as our secrets. And of course that, there are sometimes safer places that we can talk about these things and places that are less safe. But at a broader scale, I think the real thoughts I have are, around policy, right? How do we make care more accessible, especially in the eating disorder field? And how do we get people into treatment who are not maybe otherwise going to get there through breaking down those financial barriers? How do we get this to the attention of Congress, Senate, that we need more research dollars for mental health? We spend so much funding in other places, but clearly even more so after COVID, we have this mental health crisis, or amidst and after the acute phase of COVID. And then how do we tackle places like schools, colleges, workplaces, educate people around diet culture, health at every size? What are the risk factors? I care a lot about suicide prevention as well. So how do we kind of talk about the hard stuff, and not just in our individual relationships, families, communities, but also at these broader levels. And I think some of that is storytelling too. I think as humans, we can hear about data and statistic, and that's one thing. But again, what you're all doing here is, sharing stories and human experiences. And I think that really plays an important role too.
It's the magic of bringing that all together, the data and the stories. And I love if we walk away from this question and say we need to lean in. We need to lean in and talk about these tough issues. I love that. Thank you.
I always say behind every statistic is a person and a family that have been affected. And those are the stories that need to come out, because statistics are just numbers on a piece of paper. But we have to turn those statistics into real life.
So we all agree the stigma is so pervasive, and no one is immune from an eating disorder, and especially driven, more perfectionistic, highly functioning people seem to be a little more susceptible, right? And that would mean that many professionals and medical professionals also have issues with things like eating disorders. So can you tell us about co-leading a supervision group for eating disorder professionals with their own recovery histories and what the response has been?
Yeah, so this was born out of partly my own experience and then partly the experience of my colleague who's a dietitian in the field with her own recovery history. First year or so when I was practicing, when I made the move into eating disorder practice, I did not share that I was a clinician in recovery. I was nervous. I had been told at different times in my life that that was potentially not the right thing to do. And so I just did what I was doing and I paid attention. And I noticed people saying certain things or comments made around professionals in recovery, and just noticed, as you were already saying, Linda, just the stigma even amongst professionals that we in some way have to be these perfect people before we can help and walk alongside other people. It's just, isn't the case. Though, of course, you want someone with a certain amount of capacity and recovery to be to have that with them. So at a conference, my colleague and I were talking about this level of stigma and thought, well, where is the space for eating disorder professionals with their own recovery histories to freely talk about that, to freely talk about how both the benefits, how might they bring that into their practice as a strength, and how might that be a challenge at times. And we really couldn't think of many or any places. So that led us to start this supervision group, which has been around for probably about 3 years now, off and on. And the response has been incredible. We've had some wonderful people in the group, and it's, of course, a very confidential group. It's a safe place. It has a process orientation to it, so people can talk about how they're feeling, different themes, and also a hesitation. I think there is still that trepidation, fear of what if people find out? What if, my colleagues find out? Whereas, I think about sometimes the addiction community where it's a lot more celebrated to be a professional in recovery. It's sometimes much more of a badge of honor than it seems to be in the eating disorder field, though I like to see this moving, and that's part of my efforts to bring less stigma and shame to the eating disorder professional community.
And so many times there's co-occurring disorders too, right? If you have an eating disorder, you almost always have anxiety, right? And and substance use issues are a huge problem across the population, and sometimes they intermingle, and all those things are so hard for the average person to deal with. But I'm sure for professionals, it is so much harder to come clean and to reach for the support that they that they need. What everybody needs when they're struggling with something, especially something that can be life-threatening. So, and I know it seems like it's a different kind of shame if you have an eating disorder, because people just can't wrap their head around that.
I love that you've created that space because it truly is something that's needed. And so it's wonderful. And I hope that concept grows and expands across so it's available more broadly because it's real. Yeah. It's honest.
Yeah. Interestingly enough, yesterday I had some time at home and I stumbled across a YouTube documentary about the Carpenter story. And it was, the life of Richard and Karen. And when Karen, started struggling, it became obvious that she was losing weight and, a lot. And then Richard had his own substance use disorder, and how everybody embraced him and his recovery and going into rehab for that. But the family just kind of didn't want to talk about Karen's problem, and just told her to
bigger clothes
when she was on stage to wear puffier clothes or put a jacket on.
Shame and stigma.
Yeah, but that's 40 years. I mean, she died 40 years ago, just a couple of weeks ago, and and it's gotten better, but we still have a long way to go.
Yeah.
So you have your years of experience, lived experience, and professional experience, and now you have your own practice. And so how has those experiences changed the way you counsel your patients?
Yeah, I think it gives me a level of hopefulness and patience alongside with a level of seriousness and urgency that I think all has to go together to provide quality care and genuine care, as you all know. And I come at this from a very personal place, a place of, again, at times being told I wasn't, my future was uncertain. And so I think it's really important to, for me in my practice, to offer competent care. So I've done the best I could and continue to do the best I can to stay up to date on what are the best treatments, what are the best ways to, help people recover in a field that still is growing in terms of its body of knowledge on how to do that. I think it's also made me a pretty fierce advocate for my patients, in terms of working with other providers, in terms of working with treatment centers, in terms of working with families and friends and any support systems. Before I went into private practice, I worked in medical social work, I worked in obstetrics. So I wanted to make sure I had a full body of experience working with humans across different stages of life and in different moments of even life and death. And so I feel like I have some understanding more of the physical complications that can happen, how to work with the medical team, how to work together, again, to advocate and support people into a full recovery or into whatever recovery is going to look like to help them live a life worth living. And I do that again from this very, very personal place. And I think there sometimes is this like shorthand that happens where someone can come in and not have to describe too much. And there's a getting of it. And of course, always a curiosity and making sure I'm really getting it. But I do find it gives me this, hopefully most days, this understanding and this desire to really be in it with people. And whenever I take someone on, I really take on that responsibility to the degree that, we're all responsible for our parts. Yet I deeply care about the clients I work with. I consider it a deep honor to be present in terms of times of suffering and in times of growth and change.
Do you accept virtual clients, or are you just in person now? I mean, now that COVID is wound down a bit, so.
Yeah, I actually did virtual before we were all doing virtual, because I'm licensed in Massachusetts. Some people would come to me that way, so I would do virtual with them before COVID. So I'd say my practice right now is pretty 50-50.
But if somebody wanted to work with you virtually, they would have to be in your state, or Massachusetts, either Rhode Island or Massachusetts. Okay.
Yeah, that's the way our kind of licensure works in terms of social work for now.
Your comments about connection throughout this whole conversation, I think it's just so important. And to hear it from a provider and someone who just listening to you, you can hear your compassion and dedication to your patients and how important it is. And it's wonderful because often we've heard stories of providers who maybe don't have that connection and compassion. And particularly with eating disorders, I think we all realize that's the it. You have to be able to connect with that patient. They have to trust you. They have to believe that you're kind of in their corner, because sometimes you're the first one that's saying, "Hey, we're gonna work together on this. We're gonna make change happen." Anyways, I want to talk a little bit more. Your website's awesome. Listeners, check it out. They're wonderful resources. And as I was reading through, one of your articles has a section on perfectionism. And I just loved the whole concept of being enough, self-acceptance, and how important this is in relation to connection and a feeling of belonging. So often someone who's in the depths of an eating disorder doesn't feel they belong. They don't feel connected. Can we take a minute and talk about this quote? Here we go. There is no perfect way to work through perfectionism. Consider utilizing the practice of radical self-acceptance in which you embrace yourself wholeheartedly while proceeding towards change imperfectly. And I love every word. It's a great quote. Just love it. Will you expand on that a little bit and how people respond and where you go?
Yeah. Thank you for pulling that out and sharing it. I think so much of the experience with an eating disorder is this shame, this hiding, often this hiding of this beautiful, sensitive self, these feelings of judgments, feeling like you just said of not belonging, not feeling connected or good enough. So radical acceptance, turns that all on its head and says, in this moment, as you are good enough, you are whole, you are worthy of care and belonging. And radical acceptance is it's been around for a long time. I was introduced to it through dialectical behavioral therapy, and it really talks about experiencing ourselves and reality as it is right now. And by doing that, then we can make change. Then we can grow. Because if we're not accepting our reality, if we're living in a place, again, of judgment or denial, right, then we can't do things to change and grow towards the directions that we want to live our lives in. So I think about, in terms of my recovery and the way I work with clients, that always pushing against the shame of, I shouldn't talk about how I feel. I shouldn't tell, people what's really going on with me. I'm fine. Everything's fine, right? Where true connection is born from vulnerability, and in both good times and bad. So radical acceptance, I think, helps further that point, and can be a real the possible tool to build meaningful relationships.
Beautiful. Your website is in our show notes. Would you also like to tell the audience what your web address is?
Sure. Yep. It's my first name and my last name, which is BrookeHuminski.com. I'm very proud of that website. I worked on it really hard when I first started my practice. So thank you for looking at it.
Of course. Right. Okay. So we talked at the beginning of this podcast and you mentioned how somebody had said something to you. I think you said it was your counselor, and how God and faith were a big part of you looking at things differently. And that has been very relevant for me too during the hardest times with Emilee. I talk to God a lot, and I don't know how you get through anything tough without some kind of faith. So music, theater, church, and pets are all wonderful ways to connect, form community, and raise our energetic vibration. Have these things always been driving forces in your life? And how have they helped you on your journey?
Yeah, I agree with you, Linda, about the value and importance of getting through life with any type of faith. It has, I've always been this, again, sensitive, anxious, spiritual person. And I would walk to this Episcopal church when I was younger in my town, joined the choir. And then for a long time with the eating disorder, I stopped singing. I stopped doing musical theater, which I really loved doing when I was in high school. And fast forward to the present, I go to shows almost once or twice a month, and the touring ones that come through Providence or in New York City. It really connects me to this richer expression of self, the way you see things. And I see things on stage, and the dancing and the music just expresses this richness of life that I really enjoy being tapped into. I had this amazing cat through my recovery. Her name was Lizette. She was wonderful, and she just was like a soul cat is how I described her. And now I have a lovely a cat named Francisco, and my dog is named Maisie. Maisie's working on coming into the office and working with my clients, and they're just bundles of joy, and they remind me to play and connect with the present and what's really important. And then my faith is through various different forms and iterations has been life-saving. It's I'm very, very grateful at this at many points in my life to have found community and to have people say things about faith and God that have resonated with me, like the dietitian and just people showing up at the right moments. For example, I have this wonderful church I've connected to, this Episcopal church in Rhode Island that I just really connect with the community there, connect with the priest and the choir. I sing in the choir there. That's a big way I connect with God and pray. And during a difficult part of this year, the priest at my church did this kind of dance prayer movement engagement with me, and I since then have been just dancing in my apartment at times, dancing to musical theater, dancing to other music. And again, for me, it's this like wholehearted way of connecting with life and something bigger than me.
So well said.
That's great. So you have your own private practice, and you're helping so many people with that. But apparently you need more, and you work part-time. And this is wonderful, and this is something, as I read this question, I thought about Linda and I and Emilee, but you work part-time as a psychiatric emergency room clinician, and you evaluate adolescents and adults in terms of their mental health and their substance use crisis.
In times of
substance use crisis. It must be so important and so appreciated. And as I said, we've been there as parents and through those emergency room visits, and wish that there had been someone like you who was the one to see Emilee. And So can you tell us a little more about that part of your life?
To see Emilee and to see us as her parents too, as the person. It's just, that's such a beautiful thing that you do.
Well, I was certainly was thinking of you all, and I was listening to your book and thinking about Emilee and just the crash landing that sometimes it can feel coming into settings that are hostile, right? You know, I think about a medical emergency room, and I think about how difficult it can be for patients with mental health issues. So I'm really fortunate to have found this role at a freestanding psychiatric hospital. So all we do is mental health and substance use emergency, or mental health and substance use treatment. But my role is it's like separate from medical ER. The patients come in and go through a process that is a team approach, and my part of that team is to do the evaluation, so to gather the story, gather the information from the patient coming in, from the family, from the support system, and I absolutely love it. I absolutely love the people who come in, the variety of humanity that I get to sit across from. You know, I do my best every day to just, again, try to be present with people in times of suffering, which is, even when before I didn't know what I wanted to do with my life, that was like something that popped in my head as a bit of a mission statement through all the turbulence. You know, I just wanted to be able to be present with people in times of suffering, because in those moments, like, what do you do? Where do people go? Where do people find care? And in this role that I do, which I like so much about it, I'm part of a team. And I'm part of a team of compassionate nurses, of mental health workers, intake coordinators, psychiatrists, psychiatric nurse practitioners. And we think collectively about what would be the best plan. How can we get this person either into the hospital for treatment, into a partial hospital program, into outpatient treatment? Certainly the challenges that we face there are, as in any mental health treatment, you know, issues with housing instability and homelessness, issues with access to treatment. So what I like about what I do there is that the treatment is right there. So people can be connected either immediately by coming into the hospital, or through our partial programs, or through a network of providers in the community. So it's different than my therapy work, and it provides me a nice balance, because I really do like being part of a team and seeing the dynamic change that can come from that.
Boy, Ellen, could we abuse that?
Oh my God, I'm sitting here thinking, what a concept that should be universal, because that's the it. Mm-hmm. You want to take better care. You want to give good responsive treatment at a time when it's needed and be comprehensive. Oh my God.
So the key is that it's a psychiatric hospital and everybody is trained, right?
Yes.
They're trained. They get it.
Yeah.
And so,
and the people who are coming in know that you just know you're in the right place, instead of, just go to emergency, because you don't know who, what, when. Are you going to be lucky? Are you not?
Well, and chances are that most everybody that you see, and maybe every clinician and medical professional you see there, will be able to see the person through whatever illness or disease
absolutely
they're dealing with.
Trained.
Right?
That's their Oh my God, I love that concept. Yeah. Oh, we have research to do to find out, is Rhode Island the only place? We got to look into this. I love that concept. Incredible. Okay. We're going to shift topics a little bit. But I'm curious what you can get from your experience. How can we as parents, friends, partners, siblings better support our loved ones when they're struggling? What do we do when we feel something's not okay? Something's just not right. How do we support our loved one? And also, how do we support our loved ones when we know they're discouraged, they're feeling overwhelmed? There's times when we all need some of these little strategies and almost validation that yeah, that is a good thing to do. What are your thoughts?
Yeah, I love those questions in there, and they're hard ones.
Yeah.
I think about sometimes we just don't know what to say, right? We don't know what to say. And then I think maybe then we don't ask, or we don't feel comfortable, or maybe someone else will say it. And I'm speaking from my experience here. I think of when someone goes through any type of mental health issue, or sometimes during grief, right? Well, I don't want to say the wrong thing, so then I'm not going to say anything. And that's really human. And I've done that myself, right? So I think the key here is, you said it already, the validation, the leaning in, the asking, the trusting of that gut instinct. I think there are ways that partners, parents, family members, coworkers, I know for me it was really a body of friends, professionals saying, like, we're with you, we're here with you, we're ready to support you. Even if right now you need a little bit of space, we're going to come back and check on you. We're going to ask you some of those pointed questions that may be hard to answer right now. And if you don't want to answer them, that's okay. We're still here no matter what. Starting with validation, that's one of the main tools that I teach parents, especially when I'm working with adolescents, young adults, because it would be hard in that moment to validate a feeling or a thought that might seem like it doesn't really make sense outside of, an eating disorder or a mental health issue. And then going from there, I often work with families and support systems, broadly defined, on sharing with them the skills that I'll teach the patients I work with. So what are some ways to immediately regulate in the moment with distraction, with self-soothing, with connection with others? So I'll send those resources along to support systems. I will also just try to make sure in response to this question, make sure people have a community, and that the support system people are also getting their own support. I think that can be a really tricky piece too. And we're, certainly had in my life supporting other people. And then I have to take a step back and say, okay, what can I do to refill and recharge so I can sustainably support someone? But it comes back to that perfectionism. There's no one right way. There's no perfect way. And the people in my life who I've received support from, whether it's, professionals, friends, family, it's that consistent way of being there, even when, I might feel shame about having some type of reaction or emotion or sensitivity, that showing up over and over and over again. And I think about that dietitian I mentioned, or this doctor, or the psychiatrist that I worked with for almost 20 years through highs and lows. These people who continue to show up in this very gentle and compassionate way. So you don't have to be perfect to show up. It's this dialectic, and there are tools that can be helpful to be in there for the long run, and then to also help people during these times of crisis and difficulty.
And it's hard to feel connection if you don't have a space that's safe enough that you feel safe in to share, right? So that's the first thing, is holding that space for somebody else is really a gift that you give them. Yeah. And it opens up that door. And that is the key to healing, is connection. Truly is.
And it's a gift I've been given when I think of, the quality of my friendships right now, the quality of my experiences with my coworkers or at my church, or, it's that vulnerability and connection that I think, for me at least, kind of fosters my own continued recovery and ability to support others.
Well, Brooke, thank you. This has been wonderful. And would you consider moving to Rochester?
We'd love that.
I would love to come and visit.
No, I mean, move here permanently, so you could help so many people here.
I'd never say never, right?
We don't have an ocean here, but our door is always open, and we do have a lot of really neat things here. This is a cool place to live. So if you ever want to come this way, our door is open.
I love winter. Yeah.
You love winter? Perfect.
I do. And we're not getting much snow down here, so
It's been pretty mild even
pretty
here.
Mild here too, yeah. But this has been wonderful. Okay. Thank you so much.
and Brooke connection. The end of that evening, I felt such a connection with you, and I'm so happy for you and all that you're doing to help other people. And I thank you for taking time from your busy schedule to be on our podcast. I know it will resonate with so many people. Thank you so much.
Brooke, it's delightful. And truly, you inspire me and all of us to know that there are clinicians out there and who really, really get it. There is support. There is help and recovery. And so thank you. Thank you, thank you, thank you. Continue to inspire many, many, many.
Thank you.
Please know how much this meant to me.
I'm sorry about that.
No, just please know how much this meant to me. I'm sorry to interrupt. Yeah.
No, wow.
I really am honored and appreciate the work you're doing so much. So thank you.
Right back at you. Thank you also to Rockbox Recording and Production and sound engineer Scott Fitzgerald for expertly producing our podcast and so much more.
Help us continue the conversation. Please rate, review, share, and subscribe to Once Shattered on the podcast on the platform you are listening to us on. Thank you so much.
And also remember, Rockbox is the place to record your podcast, record your audiobook, or do a legacy cast for your loved ones. Thank you, everyone, for listening, and we'll be back next time.
Thank you. Thank you, listeners.